Hi, this is Dr. Dalia Murad. I work as the Head of Inspection and Control Department at Sharjah Medical District for Ministry of Health and Prevention in UAE. First of all, now the community pharmacists are being the most easily accessible healthcare professional in the community, and they are advising patients upon different ailments, and one of which are the dermatological problems or the skin problems. So once they have an undiagnosed case of skin problem, pharmacists should have a certain skill of diagnostic ability so as to decide whether to refer the case to a dermatologist, or they can just advise and counsel the patients with the skincare products that are available in the pharmacy. Now, when it comes to the role of pharmacists with the dermatological conditions, they have different roles. One of which that they could advise and through the intervention and counsel the patients upon the best use of the therapy and medications. They can also support the patients for the patients of long-term conditions with skincare conditions. They can just intervene through medication management and help them to achieve the optimal results out of the therapy. The third is that they can act as health promoters in the field of dermatology. And one of the most important activities for the pharmacists in the community is that when they counsel for sun protection as a preventive measure against skin cancer, as a measure to reduce the risk of skin cancers. They could also make use and utilize every opportunity with the patient to spread the awareness in regards of the importance of having a good skincare regime, daily skincare regime, and what are the outcomes of not having a good one. They are very expert in finding out who are the patients to have complications or skincare problems, maybe due to medications or certain medical conditions. Let's say, for example, the diabetic patients. They are to be counseled, for example, not only to maintain their glycemic control, but they can also be advised upon how to have a daily skincare regime to avoid the complications of dryness of the skin, like using the emollients and cleansers and moisturizers daily. So overall, eventually, pharmacists do use their knowledge and expertise to advise patients upon different skincare problems and spread the awareness for the proper skincare. Now, pharmacy is a dynamic and evolving profession, and it delivers complex and critical care to patients in the community. This dynamic feature of the profession has led to the shift in the kind of training and education practices of current and future pharmacists. Moreover, the arising of new challenging roles and responsibilities of the pharmacists makes it very much necessary for the pharmacist to go for ongoing continuous professional development. Now, this will ensure that the skills and competencies for the pharmacists are being maintained, and they are up to date with the advancements of the profession, as well as the development of the pharmacy profession overall. Now, in brief, the continuous professional development is very much necessary, as it will support the professionalism and the personal needs of the pharmacy professionals, and it will also support innovation and role development. Now, pharmacy is an innovative and entrepreneurial sector, and it constantly delivers fresh perceptions for how to achieve the best practices and excellence. Now, the best practices is the best way to convey them is through the pharmacist networks, which is achieved through the big conferences and main congresses like the third GCC Pharmacy Congress, and it is best understood when they are being discussed through real lifetime stories and creative problem solving and achievements. The Congress will also be a very good opportunity to have a look upon the innovations in the pharmacy field, because innovation in the pharmacy sector nowadays, I believe as per the directions of His Highness Sheikh Mohammed bin Rashid Al Maktoum, that innovation is a must for organizations to maintain their sustainability and competitiveness. It's not luxury anymore. So sharing the best practices will eventually and definitely enhance the performance of pharmaceutical organizations. It will cut costs through better productivity, and it will lead to delivering better pharmaceutical services to the community. So wish you all the best and success in the Congress.